Hello and welcome to this UniTaster On Demand event today. My name is John Cheek. I'm here from UniTasterDays and I'll be hosting this event. And with these events, we provide introductions to studying different subjects at university. And the subject we're going to be looking at today is public health. With these events, we cover four main themes: why you might be interested in studying the course, what to expect on it, a guide to application tips and potential careers as well. Now, I'm absolutely delighted to be joined by Dr. Ross Wilkie, who's joining us from Keele University. Ross is a senior lecturer in public health and epidemiology, and I couldn't think of anyone better to provide an introduction to studying public health at university. Over to you, please, Ross.
Thanks, John. So why study public health? So there's increasing interest in public health over the last couple of years or so, more so stimulated by the coronavirus pandemic. But there are lots of reasons why you might be interested in studying public health. So generally, public health is about improving health, well-being, and quality of life for individuals, communities, and populations. So we're essentially interested in improving population health for as many people as we possibly can. I think public health is of interest to lots of people for different reasons. If you've got an interest in the environment and how it impacts on health, this could be a course for you. If you've got an interest in healthcare systems and how that impacts on health, public health would be a subject for you to develop your knowledge in. If you're interested in how science can impact on population health, again, this could be the right thing for you. So public health is a broad topic, it's a broad area. This is the formal definition here that the Faculty of Public Health in the UK use, and they highlight the breadth of this by describing that public health is about the science and the art of how we promote and protect health. And what importantly it highlights is that lots of people can contribute to that. So you may be strong in science, and that may develop a background to have an interest in how health problems occur. But also the art is about how we improve health within the population. So what we look for ultimately is people with different types of interests and different types of skills to be able to contribute to improving health for a wider group of people within the population. What I can say is that public health is the most successful health discipline because it's had the greatest impact and the most positive impact on the greatest number of people within populations. So it's very much about making larger groups of people well and healthy and how we understand how to do that. And there's lots of science behind how we can do that. And we'd like people to join public health so we can continue to improve that. We can say it's about epidemics. Ultimately, it's about how we prevent epidemics. So if we look at these two at the top, we've got coronavirus here on the left and we've got measles here on the right. And these are two epidemics that are communicable diseases that we can manage and we can prevent other people from getting. So it's all about how we can control the spread of communicable diseases. However, before coronavirus, and what still needs to be the driver for population health and public health, should I say, is that we target non-communicable diseases. So these are diseases such as cancer, heart disease, back pain, arthritis. These are conditions that are occurring more than they need to. They are epidemics because they occur more than they should be occurring within the population. We know what the risk factors are. We know what the interventions are that we can use to reduce the incidence, the new cases, and the prevalence. That's the number of people who've got it. But by having a population approach, we can prevent these conditions from happening, and then we can prevent the need for people to use healthcare services. So importantly, public health is about empowering people. And the best thing we can do is to prevent health conditions from happening, because prevention is better than cure. And ultimately, if we can do that, we stop the need for people using health services, but we also allow them to stay healthy and they've got a better quality of life. So that's one of our key mottos for public health, that prevention is better than cure. But just going back to the discipline, it is a broad discipline. And if you're interested in public health, it may be because you want to reduce inequality. It may be because you want to reduce the role of environment. But there are lots of different topics within public health that would welcome you to develop your skill base and practice as a public health practitioner. So what would you expect to study if you came on to a degree programme in public health. So there are 4 key areas in public health that you would cover: health protection, health improvement or health promotion, health services, and applied epidemiology. So if we start with health protection is about communicable diseases or infectious diseases. So examples of that you'll be aware of are things like coronavirus, measles, malaria. And we're also interested within health protection in environmental factors that might cause an impact on health. So what you would do within the health protection sections is learn about viruses and bacteria and how they can spread and cause poor health, but importantly, how we can manage that. And that's about how we manage an outbreak. And you will have seen some of that in the coronavirus pandemic, albeit at an extreme level. But there are lots of infectious diseases around that you're not aware of because they're managed really, really well. But you would learn how to do that within the programme. Health improvement is about non-communicable disease. So this is about how we understand cardiovascular disease like heart attacks and strokes. It's about how we understand cancer, how it occurs, how you can prevent it. And it might be worth knowing that a large number of strokes, cardiovascular diseases and cancers are preventable. And what we do within the course is introduce you to the reasons that they are preventable, what the risk factors are, how we can treat it. And importantly, it allows you develop your knowledge of the wider determinants of health. And this is the reasons why inequality happens. But it also introduces us to global health. And this is, of course, that if you want to work worldwide, this provides the basis for you to do that. Linking that with global health, what you can also do is we develop your knowledge of health services and how you can improve health services. And ultimately, we'll introduce you to what the structure of a health service is and how you can work to improve health services, whether it be in primary care, which is the current drive by the World Health Organization, but ultimately all the different factors within how you do that is important to provide you a platform to do that. Now, really important is epidemiology. Now, epidemiology is the science component of public health, and that allows us to understand how common health conditions are, what the risk factors are, how we treat them. And it's the epidemiology, it drives the need for the different types of targets that we've got within public health and how we can best treat them. So they are the 4 key areas that you would cover within a public health degree. And importantly, what we would do is develop your skills based on the UK Public Health Registrar Framework. That means that the skills that you would develop in those 4 different areas, albeit mapped to these 8 domains, but would allow you to begin to practice as a public health practitioner on completion of the degree. So automatically by doing the degree, you can begin to look at jobs that you could work at within public health. So ultimately, you could work as a public health practitioner, and we say that's UK based for simplicity within this presentation, but it may also allow you to work for a non-government organisation or an international organisation globally. Skills we develop would allow you to work for those organisations. But it also can provide a platform for a further career within public health. You may well decide to do a master's in public health further down the line, but there is a linear career pathway within public health, which means that once you do the degree, you can do further training and work up a public health career ladder, with the top of that ladder being a consultant in public health, which means that you could be directing the public health care within a locality that you're looking after. But it can also be used as a vehicle for further academic training. So I mentioned the Masters in Public Health, but if you're interested in developing your academic career, it also is a good introduction to research. And that would provide a good basis for you to, again, to go down perhaps a different career avenue. But in health, we practice evidence-based healthcare, evidence-based public health. And by contributing to research, you will continue to contribute to the development of public health. So ultimately, what we would be studying within the course is that you capture and get to know this determinants of health model. And by understanding this model, it means that you can understand that interaction between individuals, their lifestyles, their environments, the wider policy, the wider world, the ecosystem is really, really important for how that can drive health. But by understanding all that, you can then begin to put interventions into place that will go on to improve the health of people. So application tips for the public health degree. So going back to the previous slide, I outlined that public health is a broad discipline, and it's about the interaction between science and art. So that means that we're looking for people with different skills. So the main thing for me in an application would be that you basically show enthusiasm to study public health from your own background. And ultimately, your overall goal is about improving health, quality of life, and well-being for individuals and large populations of society. You may well want to talk about interests in inequality or interest in the environmental factors, or generally have an interest in a specific health condition or a population. That would be really useful, because within our course, we are able to take that and then develop your knowledge based on what your interests are. And that's one of the good things about the course at Keele. So I would really encourage you with your application, really just to tell us about your reasons for why you would want to do public health, and support that with your interests. In terms of particular subjects that we look for, we don't ask for anything specific, but we would highlight that we would like you to be able to write reports and also be able to understand just basic numbers, because that's where some of the epidemiology comes in. But I would just wish you well in writing a personal statement that highlights that you've got an interest in health. So what careers could you have following a degree? So we, importantly, within our degree, link the aspects and the teaching content to the UK Public Health Registrar's framework. So that provides a platform of skills that allows you to practice as a public health practitioner as soon as the degree finishes. So you may well go on and look for jobs that could be in public sector organisations, perhaps the public health sector organisation, could be the NHS, could be local council, could be private organisations. You could go and work for large workplaces or employers, or there could be third sector areas, which would be working for charities or other non-government organisations that focus on improving health, perhaps for vulnerable populations or perhaps just for wider populations, depending on what their remit are. There are lots of various roles, so we can talk about some of the roles that you might have within the NHS. So your understanding of risk factors and some of those epidemics we talked about, such as heart disease and cancer, will provide you an understanding of risk factors that would allow you to become a health trainer. And this might be that you work with individuals or groups of individuals to tackle some of the risk factors that they may have for poor health. So you may tackle things like alcohol use, smoking, perhaps levels of activity. If you're particularly interested in sport and activity, I would say a public health career gives you a better opportunity to increase activity levels for people as opposed to some other professions that are either, because there is that capacity and the resource that allows you to work with people to increase their activity levels. You may well work in the NHS to do health checks and looking for comorbidities. Perhaps you become a project manager. Maybe you would look at, say, women who are pregnant who are smoking, and then that project might allow you to try and identify why women who are pregnant continue to smoke and look at how you can try and stop them from smoking. If you're more interested in, say, working with information and science, other job opportunities could be that you have an intelligence role, and that's about collecting data from various sources and then using your interpretation of that to use that to drive further health improvements within the local area that you've got. Should you be interested in infectious diseases, there's lots of roles within the health protection teams, and that again is about basically being an investigator. If you like to unpick things and try and work out why things are happening, basically a health protection worker is someone who's a detective. They detect why things are happening and what we can put in place to prevent things. So there are lots of opportunities, career opportunities, once you've completed a degree in public health. And what we would like you to do is to come to our degree with some ideas about what you want to do, and we can help you develop those. But if you'd like to talk about career opportunities or the course further, you can please contact